Long-term tobacco exposure can contribute to stubborn yellow or brown surface staining that may build up over time. A dental professional first examines the discoloration to assess whether visible staining appears external or requires further evaluation. Some tobacco-related pigments can accumulate on external tooth surfaces, sometimes alongside plaque or hardened surface deposits. Professional cleaning may first remove accessible hardened deposits that can contribute to a darker, more stained appearance. After surface deposits are addressed, professional cleaning may help reduce some stubborn external discoloration on the teeth. Professional polishing can further reduce certain surface stains while creating a smoother, cleaner-looking external tooth surface. Hard-to-reach surfaces are also carefully cleaned, as discoloration and deposit can accumulate in these less accessible areas. After cleaning, the teeth are checked again because some persistent discoloration may require a different professional approach. Professional cleaning may reduce removable tobacco-related surface stains, but results vary with the type and depth of discoloration. This video is for general education only. For tooth discoloration, please consult a qualified dental professional.